Hey everybody, welcome back into another edition of the DrBicuspid.com podcast. My name is Kevin Henry, editor-in-chief for Dr. Bicuspid, and thrilled today to be joined by a dear friend of mine, and that is Dr. Bill Simon. Bill, how are you, man?
Doing great, Kevin. Thanks for having me on board.
Hey, I'm glad to have you on board. You know, you and I cross paths so often in this dental world, and I know what a great guy you are, but tell our audience just a little bit about you before we dive into the topic.
Sure thing. I'm just a seasoned veteran of the trade, really. I've been around for a while. I've been a practice owner for over 40 years, actually a multiple practice owner for over 40 years, and just spent a lot of time in a lot of different, wearing a lot of different hats in the industry, speaking, consulting, organized dentistry, Medicaid policy review committees, a lot of different components and aspects of our profession that I've dived into. And I think it's helped me to just get a broad perspective on our industry.
You know, I know you're deeply involved with the Chicago Dental Society. I know you're a member of the Speaking Consulting Network. You know, you have your fingers in a lot of pies, as my grandpa used to say. And I know you wanted to talk today about staying relevant. Is broadening your scope one of the ways that you stay relevant as a clinician?
Well, I think that there's a lot of hats to look at when it comes to being a dentist. And you just said as a clinician. So I'm not necessarily specifically talking about being a clinician. When you're an owner dentist in particular, you wear a lot of different hats. You have to be a clinician. Certainly, if you're going to sit chair side, you better know what you're doing, right? But if you're a practice owner, you have to be also savvy in the business world. You have to be relevant there. You have to be a leader. So you have to keep your leadership skills relevant as well. And I think all of that has become perhaps more challenging, at least for me, than ever. And I don't know if it's for me, if it's more of a just an age-related thing. I've been around and, things change so quickly, or if it's simply that that's just the way of the world now, that things move quickly and it's just harder to stay relevant. I can tell you that I really was perked to look a lot deeply into relevance when I was presented with a book. And this book is called Race for Relevance. And it's a book that was written by Mary Byers and Harrison Corver. They both are their leadership of a society called the American Society of Association Executives, the ASAE. So many of our dental society directors are members of this, actually. And this book was brought to my attention in one of our Illinois State Dental Society Board of Trustees meeting. The initial edition of this book was put out in 2013, and then 10 years later in 2023 they distributed a 10-year anniversary edition that was expanded for a post-COVID world, which I think really talks to how much things post-COVID are so much even more different than they were. So the race for relevance, I think, expands to all industries, all people, all endeavors, but in our dental profession, certainly we need to take, I think, a very clear look at exactly what's in front of us and what the reality of it is.
And you mentioned a minute ago, it may be more challenging today than it's ever been with all the things that the dentists have to look at in the dental practice. How do you choose what's important or where to stay relevant in certain things that are maybe the best for your business, the best for your team? I'm curious, how do you kind of go through the clutter, shall we say?
Sure. And backing up to what you had said about becoming what I do clinically for relevance, et cetera, early on in my career, I would listen to back in the day, talk about relevance, back in the day when we had cassette tapes. So I would listen to cassette tapes of the Chicago Dental Society recording the lecture recordings. So I would listen to those on the way to work every day, back and forth. And that was very, very helpful to keep me educated. But at this point now, certainly there's a lot of ways to educate yourself in all of these endeavors we talked about. What I find is that you can't do it all. You just can't. Maybe there's somebody out there that can, but I can't. And I find that you have to decide as a dentist or as a business owner where you're going to draw the line. And the interesting thing, I think, for dentists is that not only are you the owner potentially, but you're also the machine that cranks out the widgets. That's a little different than a lot of business ownerships, right? Many business ownerships, you don't even have to be there. But for dentistry, not only do you have to be there, you have to be the machine in many cases to crank out the widgets. So I think that figuring out where you want to draw the line is really, really critical. In other words, do you want to be, I say this all the time, where on that continuum do you want to draw the line? Do you want to be Do you want to be coy, spear, panky, and the most incredibly skilled and educated dentist in our country, or do you want to be perhaps the business owner who doesn't even want to do dentistry? And along that continuum, you've got to find where you want to sit. You can be a little of each. You can be a lot of one or the other, perhaps. But whatever you choose, you've got to find people to surround yourself with that can handle the other components of that continuum. So if I want to be Spear, well, I better find a good office manager, and I better, and I better maybe, and if I want to be a business owner, I've got to, without doing the dentistry, I better find some good associates. So I think identifying where your sweet spot is, where your passion lies, is critical to figuring out where on that continuum you want to be. Because like I said, managing it all now, I think is I don't know if I'll go as far as saying it's unrealistic, but it's certainly difficult. And I also think it speaks a lot to the emergence of the DSO side of our industry. As ownership becomes more and more challenging, and you have to look for ways to either manage the business or be the dentist or vice versa.
Well, and I think you touched on a really important point is that it's okay that you can't do everything. And I think sometimes there's a lot of dentists I've seen, and I'm sure you have seen as well, who think they have to take the entire world on his or her shoulders, and that weight gets awful heavy really fast.
That's the burnout, right? That's the burnout we see in our industry right now. And
Absolutely.
yes.
So what's the best advice that you have to maybe pick that lane, to find that relevant area and really be able to hone in and focus on it for a dentist out there?
Well, I think it depends a lot on the personality type of the dentist. And really, I think looking at what your passion is, where your passion lies. The old saying that if you do what you love for a living, you never work a day in your life. And so those folks, those dentists, those doctors out there that, and even business owners, we're talking here potentially to not just dentists, we're talking to maybe office managers, other consultants. I don't know who. A lot of people listen to your podcast. I know that. Finding out where your passion lies and then putting yourself into that position, I think, is the important part. I feel really bad for any dentist, say, that doesn't get enjoyment out of doing the dentistry, yet just continues to do it because they feel stuck in that position, versus another dentist who maybe, if they had good management around them, they wouldn't have to worry about the management side, and they could focus in right in on their passion of providing the dentistry, doing a beautiful MODBL composite or whatever it might take, right?
Absolutely. And and I've got to ask because I know, again, you're so involved with Chicago Dental Society. And I think there have been questions out there about the role of organized dentistry and is it still relevant today? What do you say to those who wonder if joining your local society or becoming a part of the national association is important today?
Wow, that's a great question, and I'm glad you're touching on that. So, shameless plug for our Chicago Midwinter meeting, if I may, in February
Absolutely.
2026. Thank you very much. I'll be program chair for that, along with our president elect Phil Shefke. So I hope that everybody can make it. But to your point about organized dentistry, you look at what organized dentistry, what's the value? It's all about a value proposition, really. And is it worth it? And is there time to involve yourself in these activities? And so we see a tremendous upheaval, I think, going on right now with dental meetings in particular. A lot of state dental meetings have contracted, some of them have disappeared. And I think what we're seeing is, in my opinion, is perhaps a consolidation, really, of a lot of the society meetings. We see corporate meetings out there as well that are not related to dental associations, and many of those are doing very well. But for organized dentistry, I think that we need to focus on the fact that maybe it's not all about getting CE. Maybe the focus needs to be on that exhibit floor, an opportunity to go to a one-stop shop where you can see all of the new products, all of the new services that are out there, and focus in on that. And that's what the vendors want. The vendors want the attendees to be on the floor. And the CE we can get anywhere. But I can tell you, Chicago Dental Society, our tagline is the leader in scientific programming. So we still are going to focus heavily on the in-person continuing education until it doesn't work for us anymore. So I think that's something that's important to look at. And I like to say, I've heard it many times. Our meeting is, I don't know that it's second to none, but it's certainly up there in the top meetings. So I really enjoy being involved with that. But the last thing I would say is as far as organized dentistry goes, one of the things that I think that early career doctors in particular don't look at as a part of the value proposition is the leadership part of it and the advocacy. So the advocacy that comes out from the associations, and hey, people will say good things and bad things about the ADA. They'll say good things and bad things about state dental society, local components, whatever it is. But the advocacy component of protecting our profession and allowing us dentists to continue to practice the way that we see fit and the way that we think is the appropriate approach, that comes from advocacy, and there's strength in numbers there. And I know that there's corporate entities, corporate dental entities out there that have their own lobbyists lobbying for their agendas, et cetera. But I think as a profession, having strength in numbers through advocacy, through organized dentistry is something that needs to be considered, particularly by early career dentists.
And I will say, I was recently in Washington, D.C. with the Dental Trade Alliance and saw firsthand, going to my local representatives and senators talking about the things that are important to dentistry and seeing that advocacy. And I think once you really see the power of that, it changes your viewpoint as far as does it really matter to me and is it a battle even worth fighting?
Absolutely.
So no, I do not mind a shameless plug for Chicago Midwinter at all because I think in dentistry that is absolutely one of the most revered times of the year whenever we all can get together in the Windy City and talk about what's going on as well as see new products and everything else. So Bill, one last question for you and then we'll wrap up, my friend. What's the best piece of advice that you want to leave with our listeners and our viewers today?
I think the best advice I can give is to just keep on pushing, do what you can to expose yourself to as much information as you can. And although I'll tell you these days, the amount of information that's flowing is just very, very cumbersome. And not only is it cumbersome, but in some cases you can't even be sure if it's real. You don't know. I mean, with Chat GPT and all these different things coming at you. So what I would say is just work towards living your passion and knowing that. And I had a couple sayings that I'll leave you with. One is that these days it seems like there's so many ways to communicate that nobody's communicating. So you've got email, you've got text, you've got social media, you've got all these different ways, and then the interpersonal activity that goes on now is nothing compared to what it used to be. A lot of that has gone away, and I think it's been accelerated tremendously by COVID, by the pandemic. And so we see a lot of activity going on where people aren't interacting personally. I think that's an important thing to continue to try to do because there's I think a lot can come out of personal interaction that otherwise wouldn't, that people maybe who haven't lived in that world don't understand necessarily, maybe. Another thing I would say is that I said that as you get to my point in my career, it's definitely more challenging to keep up. And you've got all the information, you've got technology advancing very quickly, you've got generational gaps. How many generations are on the earth right now? I always say that for the first time in the history of humanity, people from different planets are living on the same planet. So you have to overcome those things too. But I think for those of us that are going along that line, one of the things to keep in mind is that I used to always say that senility has a partner. It's called obsolescence.
No.
But there's one thing that comes with time and experience, and that is wisdom. So I think that it's important for people to know that there's no replacement for wisdom. And even though somebody that may seem down the road a ways may have some wisdom that is only possible to be brought forth by somebody at that point in life. And that's it.
That's good advice. Hey, it's absolutely good advice. And do you want to let people know where they can learn more about what's coming up Chicago 2026 or what's a good way for people to get a hold of you?
Sure. Our meeting is once again going to be an incredible meeting. We're going to have some great panels and we're going to have some great speakers, great events as always. One of the things I'm excited about is I'm spearheading a panel that's basically going to talk about the changing landscape of dentistry and try to bring together many different components of our industry in a way that we can all talk about what benefits all of us. So that's exciting. We also have a really robust tech panel coming up and then a practice ownership panel as well. Let's see, what was the other thing I was going to say? The Midwinter. Oh, as far as how you can get a hold of me, let me give you my landline number. No, I'm kidding. I don't. No, I got to stay relevant. So just go to drbillsimon.com. That's
There
all.
you go. That's a great way to go.
drbillsimon.com.
great way to get a hold of Bill, and absolutely counting the days down till Chicago 2026. Bill, as always, I enjoy the conversation, and I appreciate you coming on today.
Hey, thanks so much for having me, Kevin. Always a pleasure. Take care.
Absolutely. Thanks to all of you who've listened to this episode of the DrBicuspid.com podcast. Staying relevant. It's more important than ever, and certainly some great tips there from Dr. Bill Simon. Until next time, it's Kevin Henry, Editor-in-Chief for Dr. B, signing off, and as always, wishing you nothing but success ahead.